The video presents cataract surgery in a 6-month-old baby with persistent hyperplastic primary vitreous, and I have no financial interest to disclose. I started my surgery with the anterior capsulorhexis, and now the anterior capsulorhexis is almost done. I made my side ports and then did the hydro dissection and started my irrigation aspiration. After aspiration of the lens matter, I started doing my posterior capsulorhexis by doing a puncture, then viscoseparation of the posterior capsule from the anterior vitreous to displace the hyaloid artery away from the posterior capsule to avoid injury of the hyaloid artery by the forceps while I doing the posterior capsulorhexis to minimize the risk of any intravitreal bleeding. Then I started to do the anterior vitrectomy circularly by moving the vitrectomy probe circularly around the persistent hyaloid artery. The idea is to break the vitreous bands and the attachment of the vitreous to the persistent hyaloid artery so we can move the artery and displace it away from the visual axis of the baby. As you notice, at the beginning of the vitrectomy, the movement around the hyaloid artery was a bit more difficult and it has some resistance as you see in the video, but at the end the movement became more easier and the hyaloid artery started gradually to be displaced away from the visual axis nasally. The idea is to displace the persistent hyaloid artery without touching it or even without the need of cauterization of the artery during the surgery. So I kept moving around and around until the artery displaced nasally. And finally, the persistent hyaloid artery displaced away from the visual axis of the baby. Thank you.